vitamin C and kidney stone. And actually, vitamin C probably can reduce the kidney stone formation, not increasing it, okay? And those people who develop, there has never been a study that proves vitamin C is the cause of kidney stones. Yes, vitamin C, one of the metabolites of vitamin C is oxalic acid, okay? But the calcium oxalate is one of the major kidney stones, okay? But in those people who develop kidney stones, calcium abundance or overloaded calcium is probably the major cause, okay? We believe most or many adults and seniors have too much calcium, particularly if they are supplementing oral calcium. We advise do not supplement calcium. Osteoporosis is not a disease of calcium deficiency, okay? Osteoporosis is a deficiency of vitamin C, magnesium, and hormonal imbalance and other issues, not a deficiency of calcium. This is beyond the topic of this presentation. Now, for people with G6PD deficiency, particularly in the Mediterranean area, and high dose vitamin C should be administered carefully. In general, the lower doses under 10 grams or 15 grams, the vitamin C can still be used without major problem. But you want to screen for G6PD deficiency. Okay, there's a recent article, I think it was last year, by Dr. Merrick that reviewed the literature on G6PD deficiency. And the conclusion there is that the lower dose, under 10 grams in particular, you don't have to worry about it. The hemolysis will not happen. And some people ask about oral. Oral vitamin C, we can never reach the level of IV vitamin C, okay? Even IV vitamin C of 10 grams, that will not cause a major problem in G6PD deficiency. So oral vitamin C supplementation, you cannot reach that level. So we shouldn't worry about it. And also high dose vitamin C will increase the absorption of iron. So people are already high in iron. For example, hemochromatosis patients, we should be careful with high dose vitamin C. Let's talk a little bit about mechanisms. Vitamin C, why it works and how it works. Vitamin C primarily, first of all, Dr. Pauling, as you all know, first proposed that vitamin C may be able to prevent and treat common colds and other viral infections, as well as 1971. And the vitamin C may have direct virucidal effects. So vitamin C may be able to directly kill virus upon contact or nearby. And so primarily through the production of hydrogen peroxide, vitamin C upon its oxidation. But basically vitamin C will be oxidized, and hydrogen peroxide is a byproduct of that. We all know hydrogen peroxide is a household disinfectant. It can kill bacteria, fungi, viruses upon contact. And so vitamin C in vitro, in vivo in our body can increase the production of hydrogen peroxide. Now, again, this is a high dose condition. You need to have a high dose in the blood to have this effect. And vitamin C also improves and boosts our immune mechanism, okay? Primarily by increase the macrophage, neutrophil, basically the immune cells capability. It also makes our immune cells to go to these infected areas, okay? And also vitamin C may actively inhibit viral replications, so stop or prevent the viral growth. And as I already mentioned, vitamin C is a powerful antioxidant. It is a powerful and a prototypical antioxidant. Along with other antioxidants, it is able to protect our normal healthy cells from oxidative damage from the cytokine storm or oxidative stress induced by virus, bacteria, and other toxins. And actually, as a matter of fact, as I mentioned, that I've been taking oral vitamin C, and also I have been getting IV vitamin C for myself. Yes, I get 20 grams every time I do. Those patients get only 24 grams. I'm a perfectly healthy guy. Well, I hope, but actually I know I am. I get 20 grams. My parents, my sisters. And here I didn't mention, but let me talk about it. Back Dr. Cathcart and other, VC pioneers. Basically, when we are under physical stress, the higher the stress, the more vitamin C will be consumed in our body. Okay, because all these radicals, free radicals, will oxidize our vitamin C. So vitamin C will be consumed very quickly, and that's why in acute and chronic diseases we see vitamin C disappear very, very quickly. Okay, and then the like a scurvy condition will result. And so the more stress we're under, the sicker you are, the more vitamin C you will be able to you will need, and you will be able to tolerate. And I have seen this here in COVID-19 patients. So Dr. Cathcart in particular has observed and stated that some people, normally when we take vitamin C by mouth, most people, if you take 5 to maybe 15 grams of vitamin C, you will have a diarrhea. Now, when people get sick, you may take 50 grams, 70 grams, 100 grams, or even 200 grams of vitamin C without a watery diarrhea. Why is that? It's because the vitamin C in the body is consumed very quickly by the abundant free radicals present in your body, and that enables the GI the absorption from the GI tract. Okay, so that is the bowel tolerance actually is an indication of your sickness. The higher vitamin C you can tolerate, probably the more free radicals or the higher the oxidative stress you have in your body. Okay, so this is going beyond the scope a little bit again. Here is that I believe, many of us in the also molecular society also believe that life essentially is an electrical phenomenon. Okay, our body is, you think it's a physical body. Actually, we're electricity. Okay, we are alive because we have the EKG. We have the electricity in the heart, electricity in the brain, electricity everywhere in your cell. Without the electricity, we're not alive. Okay, we're electrical body. So basically electricity, as you know, electricity is the flow of electrons. And so flow of electron is basically giving out, donating or receiving an electron. And that in biochemistry is redox. Okay, so it is oxidative stress. Oxidative, the redox reaction. Okay, so essentially health and all disease boil down at the biochemical level is a redox reaction. Okay, it's a reaction between oxidants and antioxidants. All toxins, including viral infection, fall into this category. So chronic diseases, usually we see, every chronic disease that I have researched, particularly including diabetes, the metabolic syndrome, hypertension, coronary heart disease, cancer, autoimmune disease, they all have elevated oxidative stress. And aging, there are two major features of aging, which I'm very interested in, because I don't want to get old. Life is good, right? So the two major features of aging and chronic diseases are increased oxidative stress and increased calcium burden in our body. Do not supplement oral calcium, okay? So it is this antioxidant capacity of vitamin C that I'm particularly interested in. And that is not only applicable in the acute conditions like COVID-19, but also probably more applicable once this is over in all major chronic diseases. Now, Actually, Europeans are smarter than the Americans, in my opinion. The European Food Safety Authority, back this is 14 years ago, in 2006, they already announced they concluded a cause and effect relationship between dietary vitamin C intake and the normal health.